Welcome to today's episode of the Gut Health Dialogues. Today we are talking about a very popular topic, GLP-1 agonists and gut health. This area is obviously one of the hottest topics out there, both in weight loss and the gut health world. GLP-1 receptor agonists, that's medications like Ozempic and Wegovy, are taking center stage in the fight against obesity right now. They've been real game changers in this space, being very effective to help people lose weight, manage blood sugar, and reduce overall health risks. It's pretty well known as well that there's a wide range of digestive side effects. And today I want to talk about those and also maybe the impact on gut health to consider long term, because the gut really does play a central role in how these medications work. So I think understanding this connection can help us better weigh the risks and the benefits of taking these medications. So today we're going to talk about the science behind these drugs, comparing them to other weight loss methods, and also tackle what we might want to think about as far as what's the long-term sustainability, how to manage this in the long term, say after you've lost the weight, or whether you continue the medication or go off the medication. So today I have a very special guest with us to help us dive deeper into this important topic. I'm thrilled to announce we have Dr. Lindsay Ogle, MD, who is a board certified family and obesity medicine physician who is passionate about preventative health. Her goal is to help patients stay healthy so they may live longer and fuller lives. She recently started a telehealth clinic called Missouri Metabolic Health, where she helps adults all through the state of Missouri treat and prevent metabolic conditions, things like diabetes, fatty liver, metabolic syndrome, overweight, and obesity, through lifestyle optimization and utilization of safe and effective medications. And the work she does is at the forefront of exploring the intersection of weight management using innovative treatments like the GLP-1 receptor agonist. So welcome, Lindsay.
Thank you so much for having me here. I'm excited to talk with you further about this exciting and popular topic.
Yeah, I assume anyone listening to this already is a bit interested about this topic, but why don't you just start by saying, what are GLP-1 agonists in the first place? Are they new?
Yeah, absolutely. Great question. To start off, a lot of people think that these are brand new medications when in reality, we've had some version of a GLP-1 agonist for about 20 years. And they started off as medications for type 2 diabetes, the treatment of type 2 diabetes as non-insulin options. And over time, we really recognized that not only were they helpful in managing blood sugar for these patients, on average, these patients were losing a significant amount of weight. And so they were explored if it was a safe option to use on that side of medicine. Whereas from the weight side of medicine and obesity medicine, we've had some medication options over the past few decades. The oldest one being phentermine, but there's a few other name brand options for weight management. On average, those other options that we've had have really been helpful and effective, but we see usually an average of 5 to maybe 12% body weight loss. And the GLP-1 agonist that we use now for weight management, we see more in the realm of 15 to 20% weight loss. And so this is exciting because they are, on average, much more effective at achieving that weight loss. Other exciting things are that they have not only been shown to help with weight management, but they help prevent diabetes or treat it if you have it. We're also seeing that it helps prevent heart disease, kidney disease. We're seeing improvements in fatty liver disease. So they are really touching a lot of different health conditions along with helping manage weight. And the GLP-1, that is a gut hormone. And the way that it's working is augmenting what your GI tract in your system is already doing. It's just helping it to be a little bit more powerful.
One of the main ways that it helps is it decreases appetite, right?
Hmm.
And it also decreases the rate of your stomach emptying and increases insulin secretion.
Yes, absolutely. So those are the three main ways that it helps with weight management. Oftentimes, when I have a patient who starts one of these medications, the most common names are Ozempic and Wegovy, and Ozempic is typically used for diabetes, Wegovy is used for weight management, and then there's the next generation, which is the GLP-1 and GIP agonists, Mounjaro and Zepbound, Mounjaro for diabetes, Zepbound for weight management. So when somebody starts these medications, very quickly for most people, they have appetite suppression. Some people notice that on those lower doses that we start off with, but some don't feel it until the higher doses. That can be variable. But once we get someone on an appropriate dose for them, they tell me that their food noise is turned off. I hear that a lot. So no longer are they constantly thinking about food. What is the next meal going to be? And their appetite can change. So no longer is somebody craving whatever it was that they tend to comfort themselves with, which could be sugary snacks or desserts. Oftentimes people aren't craving breads and pastas as much. Those snacky type foods, the appetite for those goes down. And oftentimes people are more leaning towards vegetables and whole grains and lean meats and things like that. So that's the appetite regulation. And then slowing down the gut happens with this medication, and that can help increase fullness. And so people are full on smaller portions. And so they're choosing the healthier foods and then they're eating smaller portions, which really helps with the weight loss. And weight management. And then the blood sugar regulation is very helpful because, as most of us know, if we have a high sugar content food or snack. There's the dive, the sugar crashes that we have, the ups and downs of our blood sugar, and that can then later on lead to increased cravings in the day. You're usually more hungry sooner than you would a typical meal that is a little bit more balanced. So having that blood sugar regulation can help even out your hunger throughout the day.
Absolutely. So it really makes sense why these medications are so effective at helping with weight loss and all of the kind of associated metabolic issues, right? But what are some of the common adverse effects? Because there are a few that are very common, right?
Yeah, absolutely. So the side effects are often related to how the medication works. The most common are GI side effects, and that's related to the slowing of the GI tract. By far, nausea or upset stomach is the most common because the food is sitting in the stomach for a longer period of time. And then changes in bowel movements are another common side effect. On average, it's about 20 to 30% of people who experience this. So 1 out of 3 to 1 out of 5 people will have these side effects. For most people, they're fairly mild, or it only happens a day or two after the injection. These medicines are weekly injections. So most of the time it's early on in that week. But for some people, they are more substantial side effects. And so it can vary in severity. It's also worth saying in the studies that about 5 to 10% of people also have these GI side effects. So even with a placebo injection, there were some side effects that were noted. But the GI side effects are real. Some things that patients can do to help mitigate the side effects can be sticking with smaller portions. And so eating smaller meals throughout the day can help avoid an upset stomach because you're not putting too much food in that stomach that's going to sit for a longer period of time. And then conversely, also avoiding an empty stomach. So many of my patients, if their appetite is suppressed, it's very easy for them to skip breakfast or skip a meal, especially if they're busy at work. But having that empty stomach can cause a queasiness in the stomach. So I always recommend patients to have at least a small breakfast in the morning to just keep some food on their stomach. Also, hydration is a major factor here. So, some people, along with the appetite suppression, their thirst is also suppressed. And so, they're getting behind in their water intake throughout the day. And when you're dehydrated, that can lead to nausea as well. So, making sure that you're drinking water throughout the day. I sometimes have patients drink electrolyte drinks, sometimes the day before, the day of, and day after their injection, and that can help offset that nausea side effect. Heartburn is another thing, and then avoiding triggers for that, avoiding spicy foods, tomato-based foods, alcohol, caffeine, those sorts of things, and again, smaller portions. And then the change in bowel movements. Constipation can happen because of the slowing of the GI tract. Making sure you're drinking enough water can help move things along, making sure you're getting that adequate fiber intake. Some people need to add in a stool softener or a fiber supplement, and that's okay. Ideally, we're getting it through the food or the water, but if you just need a little supplement, that's okay as well. And then some people have loose stools. My patients will typically tell me the loose stools are more common if they're having greasy foods or a lot of sugary foods. And so limiting those, which is our goal in general for our health, but limiting those can help limit that side effect as well.
I love that. Those are really, really great tips to manage those side effects because, like you said, there could be part due to kind of a change in your habits
Mhm.
too that happen alongside taking the medication that you can actually mitigate. And one of the things that stands out to me in the research is that even though these side effects are fairly common, they're generally mild, and that very few people find them significant enough to discontinue the medication, as I believe it's 3% of participants discontinue because of the side effects. So that's something to consider as well. I know a lot of people who are thinking about going on the medication might hear about some of these side effects and be dissuaded or concerned. So that's something that I think is important to understand.
Yeah, absolutely. And that's about my experience too. Most of my patients, if they're having the side effects, like we were saying, they're pretty mild. It's fairly rare that they're significant enough to need to discontinue. But even before we get to that point, we could try some of these tricks that we have. And I will also say for some of my patients who have not been able to tolerate semaglutide, which is the generic of Ozempic or Wegovy, they actually can tolerate tirzepatide, which is the generic for Zepbound and Mounjaro, because it has two mechanisms of action that tirzepatide does, and it provides more of a balance in the change of the GI hormone. So that is something to take note of as well.
Oh, interesting. I wasn't aware of that. So there are options,
Yeah,
and it's about
absolutely.
finding what's best for each person. What about the dosing? Because another thing I've noticed is that adverse effects tend to be dose dependent, and it's not uncommon for people to be given a dose that's much higher than they would give for diabetes, or maybe starting at a higher dose that's really necessary. So there are people that start the medication, maybe the side effects are severe, but maybe they don't need a dose is that high.
Yeah, absolutely. So, with all of these medications, the recommendation is to start at the initial lowest dose and then stay on that dose for at least a month. And then, if you're tolerating it, increase each month. To the labels on the medications, if you were to look at the recommendation, is to increase every single month until you get to the effective dose. And for weight loss, those are the higher doses of the medications, which does differ from when we use them for diabetes. We really only increase if needed for blood sugar control. But the label does say to go to those higher doses. That being said, for people who are really trained in obesity medicine, we I don't want to say are not following those guidelines, but we have more experience in managing the medications and we really only increase as needed because there are a subset of patients who respond at lower doses. And there is absolutely no reason to push them to the higher doses because, like you said, they're only going to have an increased risk of having side effects without any added benefit because they were responding at the initial or maybe the second dose. So how I manage my patients is we start at that lowest dose, give it a month, and then we check back in. If we're having appetite suppression, fullness, weight loss, even if they're not having any side effects, we may continue to stay at that initial dose and then only go up if later on we're needing the higher doses. So it's ideal if you're considering these medications or you're on one of these medications that you find a provider who is really tailoring the treatment to how you're responding to it because it really should be individualized rather than a stepwise algorithmic approach. Because I've seen people respond at every single dose of the medications that are available.
So more is not necessarily better. It's not going to get you more weight loss necessarily or make things work faster. I'm sure you probably have people wanting a higher dose because they feel desperate to get that weight off, right?
Yeah, yeah, absolutely. And as much as I, want to help them get the results that they want, and I think that we eventually can, it's not an overnight result that we're looking for. And sometimes on social media, what, we can read is that really it's a magic injection and you're going to get these crazy results in a week or two. And that is not the case. I view the medication as a tool to help you in your weight loss and health journey. And I'm always looking at the overall big picture. What is your health going to look like long term? And usually that is more of a slower process as far as weight loss goes when we're doing it with a health focus. And a higher dose is not better. You're probably just going to feel awful if you start there, and that is not the goal by any means.
Yeah, I think it's really common for people to want fast results, but think about the fact that time flies. So the point is moving in the right direction. And as long as you can
Mhm.
get that consistently going, let your body take its time, right? Because
Mhm.
as long as you're seeing that consistent, steady weight loss, that's time will fly. And before you know it, you'll reach your goal.
Yes, yes,
It just
absolutely.
It's like watching a pot waiting for it to boil. If you're stepping on the scale every day, time is not going to fly. So you have to almost set it and forget it. Like get your habits in place, find a plan that's sustainable that you can stick with. And these medications are a tool to make that easier, right?
Yes, yes, I totally agree. And I often see, as I see patients month to month, and I'm sure you see this as a dietitian, that they may often not even see the amazing progress that they're having. And I often have to remind them, oh, you're now able to do this activity that you weren't able to do before, or you have lost 10 pounds, and maybe that's not your goal of 40, but you are making amazing progress already. And sometimes when you're in it and you don't see the big picture, and that's why working with somebody who is going to support you in that health journey can be so powerful because it can redirect you to see everything that you've been able to accomplish.
That's such a great point. I think in general, we always look at what we need to do or what still needs to be done or what we didn't accomplish versus feeling good about what we did accomplish. And I definitely notice that. I keep really great notes with my patients and I keep notes about what's going on in the beginning. And it can be so helpful to review those and say, hey, look, you used to be worrying about this all day long. You used to be feeling this way. You used to be missing out on this and that. And now you're doing so much better. So I totally agree. When someone's considering using potentially a GLP-1, I personally have a family member who really, really wants and needs to lose weight, but he's scared to take these medications because there is some awareness out there. It's made the news about some of the more severe side effects. I think the one he's most concerned about is the stomach paralysis, the gastroparesis. So can you talk about how common these severe side effects are or aren't?
Yeah. Anytime we're trying something new, we definitely want to know the risks and the benefits. So it's good that, we're educating ourselves. But the rare side effects that could be more substantial are definitely more headline worthy than what typically happens. So as we said earlier, the more common mild GI side effects are about 20 to 30%. The more rare, like gastroparesis, that stomach paralysis, that's more around 1% that happens. And it is more common if somebody has had that happen before, because there are other medications or other conditions that can cause something like that to happen. So if that's happened to you before, definitely would talk to your doctor before starting one of these medicines, bring that up to them. And then it's also important to know that they are not permanent. So if you do have a severe reaction to it, of course, we never want that, but it is not permanent and we can help you manage through that. But again, very rare. These are one of the more common medications that I prescribe, and I have yet to see that personally. I've had maybe one or two patients say that they've gone to the emergency room. I'm not even 100% sure that it was gastroparesis, but went to the emergency room for a side effect. But again, that's over hundreds of patients who I have on these medications, so very, very uncommon. And some people are also worried about the association with thyroid cancer, and it's important to note that that was more seen in the animal studies, in the rat studies, rather than in human studies. And in the human studies, it's more of a association. We don't know that for sure that there is that link, or that causation from the medication. And for the thyroid cancer, it's specifically talking about medullary thyroid cancer, which is an uncommon type of thyroid cancer. It's more like 3 to 5% of all thyroid cancers. But if you do have a family member who has had medullary thyroid cancer, then that's another thing that you want to bring up with your doctor before starting one of these medications, because we at this point are being on the safe side and not prescribing it if you have that family history. But again, it's that particular type of thyroid cancer and that history of gastroparesis. Those are the biggest things that you would want to talk to your doctor about before starting.
Okay, so not very common, a lot
No.
of these things, which is great to know. And you said if they do happen, they're usually temporary.
hmm Yeah, and I
Yeah.
also, alongside that, would like to bring up the point of the risks and benefits conversation again. So, if somebody has, let's say, a BMI of 28, which is in an overweight category, and maybe they do not have any medical conditions related to weight, it may not be worth some of those risks to take a medication like a GLP-1 agonist at this time. But if somebody has high blood pressure and high cholesterol, and maybe their blood sugar is a little bit high in the pre-diabetes range, then it may be worth taking that slight risk of those more significant side effects, because we know how effective the GLP-1 agonists are. Again, and not only managing the weight or reducing the blood pressure, reducing the cholesterol, reducing blood sugar. So it's treating and preventing those medical conditions that are associated with excess weight that we know long term, if we're not managing that, then that would be very detrimental to that person's health. And when you're working with a doctor who is trained in this area, we're thinking about that, again, big picture risk benefit scenario for each person. So it's not by no
Hmm.
means, a black and white decision.
Hmm. And from a gut health perspective, we do have a couple things that we can look at in the research. Some animal studies have shown that the GLP-1 therapies can cause shifts in gut bacteria, like increasing organisms like E. coli and reducing others such as ruminococcus. And that may not be a beneficial shift, and it could disrupt the balance of gut microbes for some people. So this raises questions about the effect on the microbiome. On the other hand, GLP-1 therapies can help to maintain a healthy gut lining and reduce inflammation, as when the GLP levels are elevated, that can actually strengthen the barrier integrity or the integrity of the gut lining and help to regulate immune responses. So these effects can actually support overall gut health and metabolic balance. And also by slowing in the transit time, taking GLP-1 exogenously can allow better nutrient absorption and energy harvest, and that indirectly could benefit the gut by reducing the blood glucose spikes and promoting a healthier metabolic environment. So we're not totally clear on exactly how it affects the gut microbiome, but it seems to be complex and there seems to be positives and negatives to it. So we do need more research in some of these areas. But I wanted to ask you next about the long-term sustainability, and especially as it compares to other options. So we have other options, more traditional or historical options for weight loss. Certainly diet changes, exercise. I would say up until there's other medications. Previously, there's been medications like fen-phen, naltrexone, things like that. And then certainly bariatric surgery would be another alternative. So can you talk about the long-term sustainability of the GLP-1 compared to some of those other approaches?
Yeah, I think this is a really great concept to think about when making a decision on how you want to approach your weight loss and your health journey. So, as you mentioned, the traditional lifestyle changes, diet and exercise. Most people, when they take that approach, by the end of a year, have gained back that weight. Of course, that's not everybody, and there have been studies that have shown on average what people have been able to do to successfully keep that weight off, and exercising on average of an hour a day, eating breakfast, weighing themselves on a regular basis, avoiding TV, so avoiding sedentary activities, those sorts of things can help increase the chance of that sustainability of the weight loss. But most people end up unfortunately gaining the weight back because we know when we're dieting, our hunger hormones go up, our metabolism goes down, and that can be difficult to set long term. As far as bariatric surgery goes, there's some pretty good longer term success. I don't know the exact numbers, but I think it's around 5 to 10 years. We often start seeing some of that weight regain after that. And that can vary from person to person. So we've been using GLP-1s for weight loss for a very long time. It's only been a couple of years, so we obviously do not have that long-term data. But what we are taught and how most of us are approaching these medications are, for the majority of people, they are a long-term treatment, because we know when we take the medications away, hunger goes back, that fullness factor goes away, and people tend to regain the weight. And for an effective and sustainable option, I think medication can be a great option, especially if you're tolerating it well and you're having that success. It's something that you can take long term for the weight maintenance. And what the maintenance phase could look like could be different from person to person. So in my personal practice, what I do is once we get to our goal, as far as weight and health, we slowly reduce the dose or kind of space out the injection. So instead of doing every 7 days, maybe do 8 or 9 days, something like that, or reduce the dose to a lower maintenance dose. But then if we're seeing, our progress go in the other direction, we can always turn back and go the other way. For some people, it may look like switching to a different medicine, maybe something that is not as maybe expensive, especially if you don't have insurance coverage for these medications. We could switch to another medication option that we have. And some people want to go off of the medication, and we can definitely support that. But like I said, we want to wean down off of the medication. So, in summary, as far as we know with the data that we have, they're safe to take long term. I guess if you're extrapolating from the 20 years of data that we have from using these GLP-1s for diabetes, they're safe to use long term. They're going to continue to be effective for that person long term. I would say more we would take into account the cost of the medication, again, especially if it's not covered by your insurance. But if that is the reason you're stopping the medication, maybe working with an obesity medicine physician and finding an alternative option to replace that medication can be very helpful. I also highly recommend either working with that obesity medicine doctor to help really solidify your lifestyle changes while on the medication, or working with a dietitian, a coach, or a personal trainer. Really get solid and sustainable lifestyle habits ingrained while you're on the medicine, and then that will give you a better chance at long-term success, whether you decide to stay on that same dose or a lower dose or an alternative medication, or if you go off medication altogether. So the time while you're on the medicine is the perfect time to really solidify that new lifestyle that you're going to be able to maintain long term.
Yeah, and you and I totally agree on that because it's very easy to lean on something that makes it a lot easier to get those results. But ultimately, ideally, there are downsides to staying on the medication. There's price to think about, there's the side effects, which we've already discussed. And so if you can get off the medication, that's ideal. But right now, really, it's designed for you to keep taking it, right? And
Mhm.
for any of these modalities or these approaches that we're talking about, weight regain is very common because if you don't address the underlying habits or the underlying issues, it's just going to come back once you stop the treatment. But what a great jumpstart this can give you as far as motivation, the way you see yourself, the way you feel about yourself, the way you feel physically, and then how much easier it is to keep it going once you have that momentum going,
Mhm.
right? Once you've seen some really great results. So I love that your program actually really helps focus on giving people tools and strategies to help maintain the results long term. By
Absolutely.
far the biggest problem in the weight loss space, right, is maintenance.
Yes, yes. And when you're talking about having that excitement and the positive kind of feedback with the weight loss, that's the exciting part, that's
Mhm,
the motivating part. And it can be
mhm.
easier at that time to stick with what's getting you the results. But once you get to weight maintenance, it's not as exciting. People are not complimenting you as often. It's more mundane, and that's the trickier part is the weight maintenance. And unfortunately, there's not a lot of support in that area, and that's really where we need the most support is the weight maintenance.
Yeah, absolutely. So I totally agree on that. And that's probably a topic for a whole other episode, right? But
Yes.
something to keep in mind because there are many, many ways to lose weight quickly. So you want to think about if you're going to do something like this and start a new medication, you really want to be ready to make this work for you in a sustainable way and look at it not just as a quick fix either. So I thought I might talk about a few of the other ways that we can increase our GLP-1 production. Because as you mentioned in the beginning, we produce GLP-1 naturally in our body. And so these medications kind of act on that mechanism. Now, we don't have a lot of research as far as using anything, using the things I'm about to talk about as a replacement for Ozempic or one of these other GLP-1 agonists and how effective that is at weight loss. But we do have a few things that can affect our GLP-1 production that are naturally beneficial to consider. Maybe if you're not quite ready to jump into taking a GLP-1 medication and you want to just weigh your alternative. So berberine, which is a natural component of various different herbs, actually has been shown to improve insulin sensitivity, support glucose regulation, and it has anti-inflammatory properties, among other benefits in the body. And it has been shown, there was a meta-analysis in 2021 that found berberine lowers blood sugar levels similarly to metformin, which is an extremely common medication used for diabetes. And then when paired with metformin, the benefits were actually amplified. Now, this effect was on blood sugar effect, but it also has promising, also potential applications to weight loss because of that tight connection there is between blood sugar control and weight loss. So it might help people manage blood sugar and weight. And I do definitely have clients that use it for this reason. And you had mentioned that you have had a few clients use berberine as well.
Yes, I have. More so on the blood sugar side of things, for especially if I had maybe recommended metformin, but they wanted non-medication option. I have done very well with berberine. Usually it's tolerated pretty well, and I have seen those studies as well that it's very similarly effective to metformin. So I think that that's an interesting option. And metformin, and so by, I guess, default, berberine as well, is something that I sometimes recommend for patients who maybe have just a little bit of excess weight, especially in their abdominal region. And the perimenopausal women is a common time that patients may notice that this pops up, but insulin resistance can happen during that time. And adding something like metformin or berberine could help with that insulin resistance and then help with weight loss along with that.
Yeah, and the berberine does influence the GLP-1 production, so it is in that category as well. And then there's also, I like to mention fiber and protein. Fiber and protein also have an effect on appetite and satiety and blood sugar regulation. So making sure that you're getting enough fiber in the diet can be very helpful. And also a study in 2019 showed that high protein meals actually increased GLP-1 production, which is linked to feeling more satisfied. So as far as evidence that that leads to weight loss, we don't have evidence on that, but it is an interesting area. And it's interesting to note that having a higher protein breakfast increased your GLP-1. So it makes sense that that might be beneficial. There's also Akkermansia muciniphila, which is a gut bacteria that produces a protein that boosts the release of GLP-1. So that can also help regulate blood sugar by increasing insulin, slowing digestion, and preventing large spikes in blood sugar. But also we might be able to use it potentially for weight loss. There was a study that showed that a protein from Akkermansia reduced metabolic problems. It was a mouse study, but it suggested that increasing levels of Akkermansia through diet or supplements might naturally support GLP-1 production. So we do have some things that are natural that might be able to, or that have been shown to affect GLP-1. We just don't have a lot of research on those alternatives yet. So something to consider as we're talking about this topic of GLP-1 and weight loss. So this has been such a great discussion. My hope is this helps inform our listeners about the different things to think about on both sides of the benefits and the risks, as far as in general and as it relates to gut health. If you're considering one of these medications for weight loss, do you have any last tips or comments that you'd like our listeners to hear?
Yeah, I just think that it's good information to get out there, and it's important whenever you're hearing information about these medications or the supplements or diet in general. There is so much kind of noise in different sources to get that information from. So just always making sure that you're getting your information from a reputable source, so you are taking that and can apply it to your health, and you know that it's going to be in a safe way. And then just also remember that all of this really should be individualized to you. So just because one thing worked for somebody else does not necessarily mean that it's the right thing for you. So again, just finding a doctor, a dietitian, coach, somebody who is going to help support what is best for you long term.
That is so true. I just love what you said too about finding what works for you and also thinking about the big picture and the end game and the long term as well. We will put all of your links to your website, your social media in the show notes. What's the best way for people to find you and learn about your work?
So my telehealth clinic is at MissouriMetabolichealth.com, and you can find all of my links there. And there's a contact page. You can message me directly there. And then as far as social media, I'm probably most active on Instagram. I'm there at Dr. Lindsay Ogle, Lindsay Ogle, Ogle, and those links will be there. But you can find everything on my website, MissouriMetabolichealth.com.
Awesome. Well, thank you so much for joining us today. It's been a great conversation.
Thanks for having me.